Okay, I think
it's recording.
so. Mindy, you want to start?
No, I'll let you start.
Okay, so first I want to thank Presbyterian Church for asking us to talk about the challenges in the healthcare. So today is September 4th.
Mm-hmm.
The challenges of the healthcare is a big subject. Is it the challenges of healthcare before COVID, after COVID? Is it challenges in a personal life, challenges in the family life, challenges in the community, challenges in the state, challenges in the country, or challenges in the whole world? So it's very hard to address all the challenges in very short time. So I think we would like to focus some of the challenges that our community is facing or could be facing.
Mm-hmm.
So what is healthcare? Healthcare, we can divide into 4 categories. Together makes a total healthcare. Physical, emotional, social, and spiritual. All those are important component of the good healthcare. So physical, even pre-COVID, depended on good diet, rest, exercise, and the good diet was bad even before COVID. Processed food, high calorie, high sugar, obesity. And what we learned in COVID mortality and death, most of the people who died had pre-existing conditions, and all of them almost always was tied with obesity. So even before COVID, we knew that obesity is the #1 cause of heart disease and cancer. It was important healthcare hazard besides depression and others. Now we are realizing that anytime we have another pandemic or another stress in the human life, how important the proper diet and ideal body weight makes sense. So I think for the listener, I will say pay attention to your diet and make sure you're not eating processed food, high fat, high calorie diet, eating lots of fruits and vegetables. And it is also important to continue to do what we should have done before COVID and now is walking and some exercises. And so that's the physical part. Anything you want to add?
No, I think it's really important, and it's really easier said than done, I think, especially if you are someone that doesn't cook a lot at home. I think it's a challenge. But I think you can still try to make good choices if you're not someone that's cooking at home when you're out to dinner.
The good thing is that issue is still an issue, but things has improved.
Yes, that's been one good thing. Being home, you have to cook at home.
Yeah, and also, you can steam the vegetables.
Yes.
Or you may not make a very fancy meal, but you can get by with a healthy.
Yes.
Provided you have resources to buy healthy.
Correct. I think a lot of people also during the COVID time chose to plant a garden or do things like that they maybe wouldn't have done before because they had more time to do that, which has been a great thing because then they know what they're eating because they're growing it themselves.
So that's the physical part. Maybe we should have 20 minutes. How much we spend time?
We're on the 4th.
Oh,
4:30.
So that's the physical part, and then emotional health. Emotional health. I think we are seeing more problem with the emotional health after the COVID.
Yes, I agree. I think a lot of it is the lack of interaction with other humans, the fear. There's a lot of aspects, that fear leads to less sleep, and anxiety and depression follow. And I think that's been a huge problem with the COVID time.
I think the emotional health has been affected, as you said, plus multitude of issues. Can I pay my mortgage?
Right.
Am I going to be evicted? My loved ones is dying from COVID, and the number is not slowing down, it's increasing. Am I going to lose the job? If I have lost the job, when I'm going to get the job? How I'm going to take care of my kids who are going to the school? Are they going to bring the infection?
Right.
This multitude of issues has really created worsening of the mental health.
Mm-hmm.
And we are seeing that by increased prescription drugs, the use of more alcohol. I mean, we know the alcohol sale has gone up. We know the prescription drug for anxiety and insomnia has gone up. But that's not the best way to resolve the problem. So the long-term effect of lack of sleep, anxiety, it affects the blood pressure, health. And we're not talking about that. We are not addressing that. We are occupied with everything else, but how we talk about the mental health in the COVID time is very important. And we need to understand each other and respect each other, frustration and sometimes sadness, sometimes anger, sometimes, and it's all coming from the social distancing, not able to, and this COVID problem is not going away. We're losing the job, we don't have money to pay the mortgage. So this is not only affecting an individual health, emotional, family emotional health. If the parents are stressed, the children, they get stressed, and then there is loss of patience, more argument, more. It's like a snowball effect.
Mm-hmm.
So, are you seeing the same thing?
Yeah, absolutely. Just in my own family, absolutely. A lot of togetherness with just the family. And then also as a parent, trying to decide what's best for your children as far as their education. And schools are doing their best to make accommodations and do the best to keep kids safe. And it's a decision you have to make if you're going to send them to school or not send them to school, homeschool them, do online school. There's a lot of stress that comes with that. And then depending on how you're reacting to the situation, that fear that you have goes to your children, and then they can definitely be anxious and scared, absolutely, going back to school, fearful of what could happen. They get sick or bring that sickness home. So it's a lot at once, I think, and it's getting worse, not better, especially right now when it's back to school time for kids. I think there's a lot of communication that needs to happen.
So the real question is what we do about it. And I think the good thing is that this kind of thing has happened before. This is not the first time. So human race is a very resilient. It bounces back, it adapts. So we need to be resilient. And what are the things we could do to be resilient and get over this crisis in strong and in a meaningful way? That's the thing that we want to talk more, because that may have some meaning to people who are listening to this.
Yeah, so I think the biggest thing for me personally, and I think you would agree with this, is you have to, number one, take care of yourself as far as getting good sleep, trying to eat correctly, eat right, exercise. Sleep is a huge thing, though. I think that we forget the importance of that, but I think that's so important. And also for me as a parent with small children, trying to lead by example and teaching them those good habits that they can do for stress relief that will then help them sleep better at night, and those things are really important.
So sometimes when you are under tremendous pressure, it's hard to sleep.
Right.
And that's why we are seeing more use of alcohol. But alcohol makes you sleep, but it robs the best sleep, the REM sleep. So yeah, you are dozing off, falling asleep, but your brain is not getting sleep. That's the reason next day we have a hangover. When you thought you slept, the brain did not get sleep. So that is not answer. And then this medicine that we are using for sleep is also not a good answer because it fogs the brain in the morning. It does not allow us to think. Now, traditionally, human race survived for years without medicine. So we have a history of other things that has been done in the past. And I think we need to know those and maybe we can review those. So what are the non-pharmacological ways that will allow us to sleep?
So things that can be done that really do help and have been really proven to help are maybe taking a warm shower or warm bath before you get ready to go to bed. Quieting your mind is a huge thing. Meditation, prayer, whatever that looks like for that individual person is really important. Also keeping TVs, cell phones, things like that with that blue light out of bedrooms, because that really does disturb sleep is a big, huge thing that I need to do better myself at, but I'm trying. That we all can do better at, not really watching or being on your phone before you go to bed, because that makes your mind active and not quiet like it needs to be. That's a huge thing.
Those are very important. So I think what studies have showed that if you don't watch TV or cell phone for 2 hours, it will allow you to sleep better.
Mm-hmm.
Even though you have TV and the cell phone in the room, it affects your sleep.
We have a room full now, and Tom Yacker was waiting for his mother while she's in back doing the shot. But every seat was taken. I said, Tom, you might feel more comfortable.
So I think it is also important not to eat and go to bed.
Right.
So the following steps could be done. Don't eat at least 2 to 4 hours before you go to bed. Before you go to bed, don't watch TV, no cell phone for 2 hours. Take a shower, meditate, and maybe light up a candle, lavender candle. That aroma is very soothing. And then you blow the candle and praying to God that I'm ending my day. Symbol is blowing the candle, and I'm surrendering to you, and go to bed. Having a clean bed sheet and other also helps. So we talked about physical health and emotional health. There is a social health. Total health, social health is also important. And how we support our social health. Who we are has a lot to do where we live and how we live in the society. I think this is the time to respect each other. It's good to share the thoughts, but not being dogmatic. And stay away from anyone who is creating more stress in the social health. And that could be whoever. It could be neighbor, it could be politicians, it could be all the TV channels, because that does not help our health. Does it make sense?
Yes, absolutely. Stay away from the toxic environment of people. Sometimes that happens.
And I think at the end, our whole life is the spiritual health. That is also important now than ever. Who we are. Are we just a physical body? Are we controlled by just what we think, what we do? Or we are controlled by, God or or something like scientists will say, science, whatever. The understanding that we can do so much, and there is, if we align with the totality of the creation and human race, through whatever route we do, it brings peace in our life. So I think, going to the church and reading scripture, reading scripture is not good enough. Practicing the scripture, reading is you are reading, and then understanding is in your brain, but you have to translate to the real life. And then practicing that is more important. And here the social health and the spiritual health blends. If we practice the spiritual teaching, we cannot hate our neighbor. We cannot hate anyone. We could differ strongly, violently, but we need to continue to respect. And don't you think that's the teaching?
Absolutely.
So I think we are going through the crisis, but humans are resilient. We'll get it over. We just need to take one day at a time. We need to wake up and say, thank God, I'm alive, and I will get through the day and do our best, knowing our limitation and also our power. If we create a feeling of support to each other, that creates harmony in our life, harmony in society. That's a food for our soul, to loving other and helping others. I think that helps. And Mindy, thank you for being part of these discussions. I'll be happy to answer any questions if any one of you have. You can email to us. We'll provide Mindy and my email. And hang in there. Things are going to be better. It has to be, and it will be. Thank you.
Thank you.
Okay. I mean.